What are you doing, Emily?
What am I doing?
Yes. Besides hiding behind me here.
Well, I'm a physical therapist for 15 years. Worked in pretty much all settings. I've been home care the last 5.
But something happened recently that got you upset. What were we talking about the other day?
Yes, this new patient-driven group model that Centers of Medicare and Medicaid are changes coming in 2020.
But what's driving that?
Cost.
But didn't their government
So
change?
they're changing. It's essentially, well, I mean, healthcare, and I understand how it's driven now more on patient outcomes than how do they say value instead of volume.
Yeah, but you're doing physical therapy,
So
and
I'm
you're telling me they want to cut you back to 1 day a week with a patient?
Correct.
How are you going to get better outcomes working with people 1 day a week?
I don't think I will. I think outcomes are going to dramatically change. I think patients, they're calling it patient-driven. It's not at all patient-driven. I mean, to me, home health care, I'm coming to somebody's home to keep them out of a nursing home, to keep them safe within their home. And I think more and more people are going to be out of their home into that nursing home setting.
So what would be more
which
cost
is higher
effective?
cost
Yeah, there
anyhow.
you go. So what would be more cost effective then?
That's a good question. I don't know. It's tough. I mean, we have, well, majority of my patients are Schuylkill County. They're geriatric. They're poor. You know, we discussed about prescription. You know, this prescription plan prior.
So you're
you know,
basically describing Jack.
I'm not there yet.
Sorry.
But like these are the
I have to
people
get my
that,
shots in while I can. You know?
these are the people that, you know, they get $15 of food stamps a month. You know, they make $5 too much in order to qualify for any county programs, any assistance in their home to help them with cooking or getting a meal, getting a ride to a doctor's appointment. You know, simple things like getting washed and dressed. So like if those programs that we have, like it used to be called the waiver program, now it's contracted out and there's all these different companies that are involved. But like I feel like if there were more programs out there for the elderly, you know, that would help me do my job better. It would help me to not overutilize my visits per se.
You know,
But a lot of people don't qualify for it.
I made light of something just a moment ago, and I really have to walk that back because what you're talking about is very serious. We have people living out here by themselves who really don't have help to take care of them, to even, like you said, dress themselves or be able to bathe, and let alone do grocery shopping or be able to help them with some of their physical ailments and needs. So we need to take that seriously. We're all living longer, but healthcare, one of the big failures of healthcare, of this current healthcare system that we have, is that we don't incentivize preventive services. If you have to drop a $5 or $10 or $15,000 deductible before you get care, most people are avoiding trying to get care, if they have the coverage at all, period. So I think Emily has a thankless job here, that trying to navigate between the needs of her patient clients and a system that's constantly been a moving target for politicians to try and find a way to manage cost when they really need to start looking at how they're going to manage care.